there. So you have the opioids. I gave you the medications. I told you why it's a big problem in South Florida. I told you that there is a medication, Narcan, that can save your life. And I also talked about this program, the idea exchange. But one more thing I do want to emphasize is that an addiction is not just a bad behavior. It is a bad behavior that you cannot control alone. Why? An addiction is something that's inside your brain. So now I'm going to talk a little bit about why people get addicted, what an addiction actually is, and why it's so difficult to live with. So what can opioids give you? One, yes, they reduce pain. So reducing something bad sometimes increases a behavior. This is called negative reinforcement. So you are reinforcing a behavior by making the behavior increase while taking something away, usually taking something away that's bad so that you increase the behavior. So negative, removing something, reinforcement, increased behavior. So you're taking away the pain, so you want to do it more. But that's not the only thing that happens with opioids. Another thing that happens is it makes you feel good. And who doesn't like feeling good? I mean, that's why I work out, because I get endorphins, which is like my own body's morphine, and I feel good. So of course I'm addicted to exercise. So this is not something that, you know, you yourself can control. This is your body's physiology and your brain making you crave something because it makes you feel so darn good. And this is called positive reinforcement, because now you are also increasing the behavior, but you're giving something positive. You're giving a good thing. So giving something good, increased behavior, positive reinforcement. So now you're not only reducing pain, you're only increasing a good feeling. So of course, with these two things combined, an addiction is bound to happen. So what happens in an addiction? Basically, these pathways get so strong that all you think about is the drug, and all you think about is how you can get your next fix and what you can do and what you're gonna have to do to be able to get it. Because let me tell you something, withdrawal from heroin is just as bad as not being able to get the medication. Even worse, because when you're withdrawing, you have severe pain, you feel like you're dying. Like, I met a lot of patients in the psychiatric ward when they were, you know, going for their methadone clinic. And I'll talk about the methadone clinics later as well. And they say that they were so afraid of the withdrawal that's why they kept using the drug, because they went through withdrawal a few times and they said it was the worst thing in their life, and because of it they vowed never to go through it again, and so they kept using the drug to avoid the really bad withdrawal symptoms. Heroin use is not just bad for the person using it. Say you have a woman who uses heroin and she gets pregnant. What happens is that this baby is now born with a heroin addiction. The baby has a heroin addiction, and the baby will go through withdrawal, and the baby will need methadone. So this is not something that's just going to affect you, it also affects whoever's growing inside of you. And this is something that you guys definitely have to think about and consider. And you know, an addiction is something that can ruin your life, but it is also something that once you hit rock bottom, there's nowhere to go but up. And the best thing you can do is seek help. You know, you don't have to do this alone. There are so many addiction programs. There are so many, and I know, you know, therapy, therapy's not for me. I hate talking to people. You don't have to talk if you don't feel comfortable. You can just sit there and listen. And the more you go, the more you will see that other people have very similar stories as yours. You will feel less alone, more likely to open up some more, find a good support system, and get the help you need. And this is a lifelong process. Like, just because you've been heroin free for 2 years doesn't mean you don't need therapy anymore and don't need group sessions anymore. This is a lifelong commitment to your sobriety and your own health. And so this is something that's very difficult. It's a whole life-changing, you have to change your entire life to be able to, you know, live with this problem. Okay, last thing I want to talk about. Methadone clinics. What is a methadone clinic? Well, methadone is kind of like all these painkillers that I talked about, kind of like morphine, kind of like you know, heroin. It's still bad, but it's not as bad because it will prevent your withdrawal symptoms, but it will also, you know, keep you at a baseline normal. So you're not going to dip into withdrawal, but you're not going to get that crazy high either. So the last thing I like to say is, yes, obviously, happy Halloween. But, you know, whenever you're dealing with an addiction, or if you're dealing with something difficult, or if you see that the news is talking about opioids and the crisis and the pain medications, just, you know, stay informed. Ask your doctors questions. Tell them that you're afraid of the addiction, what you can do to prevent your addiction, what you should be doing in case you start feeling like you're depending on this medication. Get the help you need before the addiction starts. When people are experiencing pain, it is our duty to make sure that the pain is adequately treated. Pain is now the 5th vital sign when we are talking to people. I have no idea what's happening right now. So 5 vital signs that we always talk to our patients about. They're important in any doctor's office visit, and pain is now the 5th vital sign that we screen for. So when we check your blood pressure, we look at how fast you're breathing, we look at your temperature, we look at your heart rate and things like that. The 5th one is pain. So we will ask you on a scale of 1 to 10, 1 being the lowest, 10 being the worst pain ever, how would you rate your pain today? How would you rate your pain on average? How much pain do you consider you're living with? And based on your response, we will say, okay, this person is living with a chronic condition, with chronic pain. They need opioid medication pain relievers. And it is, for me, in my opinion, unethical for me to see a person in pain and not give them pain relievers. So you can see why it is such a problem. Yes, we are treating your pain, but we also have to monitor you and make sure that you're not going into an addiction process because of it. So it is definitely up to you guys, the patients, and us, the physicians, to keep in contact with each other and have an open line of communication so we can be better informed, you know, in helping you and treating you and your condition. So obviously, if you guys have any questions, please leave them below. If you have any, you know, likes, dislikes, if you guys know someone with an addiction and you want to know more about the Idea Exchange program that there is in Miami by Dr. Tooks, I will send you more information. I will send you where you can go, the things that you can ask, the people that you can talk to. There is always someone to talk to. You are actually never alone. You just have to go get the help you need. So I don't know why I'm holding this owl. It's like giving me a little bit of comfort. I don't know. But definitely, you know, send me what you're interested in hearing about and I will do that. Follow me on all social media. Don't forget to subscribe. See you next week. Bye. So the last thing I was talking about... The last thing I was talking about. Sorry, I can't see.